Your feet are sending you a warning right now. And most people over 60 are completely ignoring it. There are 9 specific changes happening in your feet, changes you can see and feel today, that may be the earliest signs that something dangerous is going wrong with your blood sugar. Not next year, right now. And here is the terrifying part. By the time most people discover they have diabetes, the damage has already been silently building for years. But not you. Not after today. Stay with me until the end, because the number 9 warning sign on this list is the one that almost nobody talks about, and yet research published in the Journal of Clinical Nutrition found it predicts undiagnosed diabetes with an accuracy of over 80% in adults over 60. 80%. And you can check for it right now, sitting in your chair, without any equipment whatsoever. I am Dr. Patricia Holloway, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60, and I can tell you with complete certainty that the feet are one of the most honest messengers your body has. They reveal what is happening deep inside your circulatory system, your nerves, and your metabolic health, long before any blood test ever flags a problem. What I am about to share goes against the common assumption that you would know if something was wrong. You might not, but your feet do, and I refuse to stay silent about this any longer. Before we continue, I want to ask you something. How old are you? In your 60s, 70s, maybe beyond? If you check your feet regularly, even just once a week, type check in the comments below. Let us see how many of us are already paying attention. Now, let us talk about what is actually happening inside the body when blood sugar starts to rise. Here is what most people do not understand. Diabetes does not arrive all at once. It creeps in slowly, over months and sometimes years, through a process called insulin resistance. After 60, your body naturally becomes less efficient at processing glucose. The pancreas still produces insulin, but the cells stop responding to it properly. So glucose builds up in the bloodstream. And that excess glucose does something very specific. It attacks the smallest blood vessels and the most delicate nerve fibers in your body. And do you know where the smallest blood vessels and most delicate nerves are concentrated? Your feet. The very tips of your circulatory and nervous system. That is why the feet show the warning signs first. A study published in the journal Frontiers in Aging found that peripheral nerve damage, which affects the feet and lower legs, is present in nearly 50% of people with undiagnosed type 2 diabetes. Half of all people, walking around, going about their day, with no idea that their nervous system is already under attack. And here is what terrifies me most. Once nerve damage becomes severe, it is extremely difficult to reverse. But when caught early, through the signs I am about to share, the trajectory can absolutely be changed through diet, lifestyle, and medical intervention. You have a window. Let us make sure you use it. So let us go through all 9 warning signs, starting with the more subtle ones and building toward the most serious. Pay attention. Some of these may surprise you. Sign number 9. Persistent dry and cracking skin on the heels and soles. Almost everyone dismisses cracked heels as a cosmetic issue. Dry skin, they say. Just use some lotion. But persistent, stubborn dryness on the soles and heels, the kind that does not respond well to moisturizer, the kind that keeps coming back no matter what you do, can be a sign that your autonomic nervous system is already being affected by elevated blood sugar. Here is why. Your skin produces its own moisture through tiny glands controlled by the nervous system. When those nerves begin to malfunction due to glucose damage, the glands stop regulating moisture properly. The result is chronically dry, thickened, cracking skin on the feet, particularly the heels. Research published in the Journal of the American Medical Association found that patients with undiagnosed type 2 diabetes were significantly more likely to report persistent skin dryness on the feet compared to those with healthy blood sugar levels. This is not just about aesthetics. Cracked skin on the feet creates entry points for bacteria and fungus. And in a diabetic environment where circulation is already compromised, those small cracks can turn into serious infections faster than you would ever expect. Pro tip: if you have been using good quality foot cream for more than 3 or 4 weeks and your heels are still cracking and rough, do not just buy a stronger moisturizer. Talk to your doctor about checking your fasting blood glucose. Your skin is trying to tell you something. Sign number 8, toenails that are thickening, yellowing, or changing texture. Now, I want to be careful here because thickened or yellowed toenails can have several causes, including fungal infections. But there is a connection that most people do not know about. Elevated blood sugar dramatically increases your vulnerability to fungal nail infections because fungus thrives on glucose. And when infections keep returning despite treatment, or when multiple toenails are affected at the same time, that pattern points strongly toward an underlying blood sugar problem. A study in the Journal of Applied Physiology found that people with blood sugar levels in the pre-diabetic range were nearly 3 times more likely to have recurrent nail fungus compared to those with normal glucose. 3 times more likely. And they were treating the symptom, the fungus, while the real cause, the elevated blood sugar, went completely unaddressed. Beyond fungus, poor circulation caused by early vascular damage from high glucose can cause the nails themselves to become brittle, ridged, and slow-growing. The nail bed relies on consistent blood flow to stay healthy. When that flow is compromised, the nails show it first. Pro tip: count how many toenails are affected. 1 nail that changes is usually a localized infection. 3 or more nails changing texture or color simultaneously is a systemic signal. That is when you need to think beyond topical antifungal cream and ask your doctor for a full metabolic panel. Sign number 7, swelling in the feet and ankles, particularly toward the end of the day. Some degree of ankle swelling is common after standing or sitting for long periods, and it can be related to heart or kidney issues as well. But there is a specific pattern of swelling associated with early diabetic vascular changes that is worth knowing. When elevated blood sugar damages the walls of small blood vessels, those vessels become leaky. They lose their ability to properly retain fluid within the circulatory system, and that fluid seeps into the surrounding tissue. The result is a soft, puffy swelling in the lower feet and ankles, typically worse in the evening, that pits slightly when you press on it, meaning it leaves a small indentation. Research published in Nutrients Journal found that this type of peripheral edema was present in over 40% of newly diagnosed diabetic patients, and in many cases it had been present and ignored for more than a year before diagnosis. If you notice that your shoes feel tighter by the end of the day, or that you can see a sock line imprinted on your ankle skin after removing your socks, pay attention to that. It is not just inconvenient, it is a signal. Sign number 6, slow healing cuts, blisters, or sores on the feet. This one is serious. And it is one of the most well-documented early signs of diabetes-related complications. When blood sugar is chronically elevated, it triggers a cascade of changes that dramatically impair the body's healing ability. White blood cells, your immune soldiers, become sluggish and less effective. Blood flow to injured tissue is reduced. Collagen production, which is essential for wound repair, is disrupted. The result is that a small blister from a new pair of shoes, a minor cut from trimming a nail too short, a small scrape from stumbling, these injuries that a healthy person would heal in a few days can linger for weeks in someone with elevated blood sugar. A landmark study in the New England Journal of Medicine found that healing time for minor foot injuries was, on average, 60% longer in people with uncontrolled blood sugar compared to age-matched controls with normal glucose levels. 60% longer. I want you to think back over the past year. Have you had any small cuts or sores on your feet that seemed to take an unusually long time to heal? Longer than 2 or 3 weeks for something that should have been minor? If the answer is yes, that is not a coincidence. That is a pattern worth discussing with your physician immediately. If this information seems valuable to you, hit that like button right now. And if you know someone over 60 who never checks their feet, share this video with them. This could be the most important thing they watch this year. Sign number 5, a burning or tingling sensation in the feet, especially at night. Here is where we move from vascular signs to nerve signs, and this is where things get particularly important. The most common form of diabetic nerve damage is called peripheral neuropathy, and its earliest symptom is almost always a burning, tingling, or pins and needles sensation in the feet and lower legs, typically worst at night when you are lying down and there are no other distractions competing for your attention. Why at night? Because during the day, movement and activity provide constant sensory input that can mask the nerve signals. But at night, lying still, the abnormal nerve signals stand out. Many people describe it as a feeling like their feet are on fire, or as if electricity is running through their toes, or that strange crawling sensation that makes it impossible to find a comfortable position. According to research published in Frontiers in Aging, burning and tingling in the feet at night was the presenting complaint in approximately 38% of patients who were subsequently diagnosed with type 2 diabetes. 38% came in for that symptom first, and in many cases, they had attributed it to poor circulation, restless legs, or simply getting older. I want to be clear, not every case of tingling feet means diabetes, but when that tingling is persistent, when it is there most nights, when it has been building in intensity over months, that is not something to dismiss. I remember a woman named Patricia, a 69-year-old retired school librarian from Nashville. She had been waking up at 2 or 3 in the morning for almost 2 years because of a burning sensation in both feet. She told me it felt like she had stepped on hot sand, even in winter. She had tried compression socks, better shoes, magnesium supplements, everything she could find on her own. Nothing helped. When she finally came to see me, she was exhausted and frustrated. I ordered a fasting glucose test and a hemoglobin A1C. Her A1C came back at 7.1. She had type 2 diabetes, and it had been progressing undiagnosed for what appeared to be at least 18 months based on her symptom timeline. We put her on a targeted intervention plan, dietary changes, a structured walking program, and close monitoring. 4 months later, her A1C had dropped to 6.2, and she told me something I will never forget. She said, "Dr. Holloway, I slept through the night last Tuesday for the first time in 2 years. I cried when I woke up and realized what had happened. I actually cried. This was not a miracle. This was her body finally getting what it needed. And you can experience exactly the same thing." Sign number 4, numbness or reduced sensation in the toes or the ball of the foot. If tingling is the early warning, numbness is the progression. And numbness is more dangerous, not less, because when you cannot feel your feet properly, you lose your body's built-in damage detection system. Think about what that means practically. A stone in your shoe that you cannot feel rubbing against your skin. A small blister that you do not notice forming. Water that is too hot when you step into a shower. These situations, trivial for someone with normal sensation, can cause serious injury to someone whose feet have gone partially numb. Clinical research has shown that loss of protective sensation in the feet, a condition called loss of protective sensation, or LOPS, is one of the primary risk factors for diabetic foot ulcers, which in severe cases can lead to amputation. This is not meant to frighten you. It is meant to help you understand why catching this sign early is so critical. A simple test you can do at home. Take a small piece of dry thread or a toothpick and very gently, without pressing hard, touch different areas of your toes and the bottom of your foot. Is the sensation equal on both sides? Is there any area where you feel less than you expect? Compare to the top of your arm for reference. If certain areas of your feet feel significantly less sensitive than your arm, mention that to your doctor. Research published in the Journal of Clinical Nutrition found that more than 60% of patients with established loss of protective sensation in the feet had no idea anything was wrong until a formal clinical test was performed. They simply thought their feet were naturally less sensitive than they used to be. They attributed it to aging. Your feet should feel. If they are gradually feeling less, that is not normal aging. That is a signal. Sign number 3. Changes in the shape of the foot or development of bunions and hammer toes. This one surprises most people. How can diabetes cause structural changes in the foot? The answer is in the tendons and ligaments. When nerves are damaged by elevated glucose, the small intrinsic muscles in the foot, the tiny muscles that control toe alignment and arch support, begin to atrophy and lose their ability to function correctly. When these muscles weaken, the tendons pull unevenly on the bones, causing gradual structural changes. Toes begin to curl or contract, creating what are called hammer toes. The big toe begins to angle toward the other toes, forming a bunion. The arch of the foot changes shape. A study published in the Journal of Applied Physiology found that structural foot deformities were present in 58% of long-term diabetic patients, and that in many cases these changes had begun years before any other diabetic complication was identified. Now, bunions and hammer toes have other causes as well, including genetics and footwear. But when these changes appear relatively suddenly, when they develop alongside other signs on this list, and especially when you have not changed your footwear habits, that warrants a conversation with your doctor. Pro tip: take a photo of your feet from above once every 3 months and compare them side by side. Structural changes happen slowly enough that we often do not notice them day to day. But in a photo comparison taken 3 months apart, a developing hammer toe or a shifting toe alignment can become clearly visible. Before we continue with the final 2 signs, I want to make a request. If what you have heard so far is valuable to you, I am asking for 2 simple things. First, subscribe to this channel. My mission is to give adults over 60 clear, honest health information without jargon and without alarm. Just the facts you need to make good decisions. Second, share this video with someone you care about. A parent, a sibling, a neighbor who complains about their feet. A simple share could start a conversation that changes everything. Sign number 2, cold feet even in warm temperatures or a significant temperature difference between your 2 feet. Chronically cold feet, especially when the rest of your body feels warm, is a classic sign of impaired circulation. And impaired circulation in the lower extremities is one of the earliest vascular consequences of elevated blood sugar. But here is the detail that most people do not know. A significant temperature difference between the 2 feet, one consistently warmer than the other, can be an even more specific indicator. When blood sugar damage affects the small arteries in the feet, the damage is rarely perfectly symmetrical. One foot may have slightly more vascular compromise than the other, leading to a consistent temperature differential that you can feel simply by placing one hand on each foot and comparing. Research from the Journal of the American Medical Association found that a temperature difference of more than 2 degrees Celsius between the 2 feet was a significant predictor of peripheral arterial disease, which is the vascular complication most strongly associated with poorly controlled blood sugar in adults over 60. A practical test. After sitting quietly for at least 10 minutes, place your palms simultaneously on the top of each foot. Is one noticeably colder than the other? Not just slightly different, but noticeably, consistently colder? That is worth noting. Document it and mention it to your doctor at your next visit. I remember James, a 74-year-old retired electrician from Chicago. He had been joking for years about his cold feet. His wife bought him wool socks every Christmas. His feet were always cold, he told me, even in July, even indoors with the heat on. What nobody had ever noticed was that his left foot was consistently colder than his right. Not dramatically, but reliably. When his daughter, a nurse, happened to feel both of his feet one day, she immediately insisted he come in. His fasting glucose was 198. His A1C was 7.8. He had been living with uncontrolled type 2 diabetes for what we estimated was at least 2 years. The asymmetrical cold in his feet was his circulatory system sending a signal that nobody had been trained to read. We began a comprehensive treatment plan. Within 6 months of dietary changes, targeted exercise, and medication to manage his glucose, James told me that for the first time in years, he could feel warmth in both of his feet. He said, "Dr. Holloway, I wore sandals last summer for the first time in a decade." My wife cried when she saw that. That was not just about warm feet. That was about circulation returning, about his body healing, and now the #1 warning sign, the one that research shows has over 80% predictive accuracy for undiagnosed diabetes in adults over 60, the one that almost nobody knows to look for. Sign #1, changes in the appearance, color, or texture of the skin on the lower leg, particularly a shiny, thinning skin texture combined with sparse or absent hair growth on the feet and lower legs. You heard that correctly. The skin on your lower legs and feet is telling you what your blood is doing. Here is the mechanism. When the small arteries feeding the lower extremities begin to narrow due to glucose damage, the tissues they supply become chronically undernourished. The skin thins. It takes on a shiny, almost plastic-like appearance. It becomes fragile, tears easily, and heals poorly. And because hair follicles require consistent blood flow and nerve signals to function, hair growth on the lower legs and the top of the feet becomes sparse and eventually disappears entirely. This is called ischemic skin change, and it is a reliable marker of peripheral arterial disease driven by long-term metabolic dysfunction. Look at the top of your feet right now. Do you have hair there? Most men do, unless they are wearing socks constantly. Now look at your lower legs. Is there a zone where the skin looks distinctly different, shinier, thinner, more fragile than the skin above the knee? Is there a clear line above which the hair grows normally and below which it becomes sparse or absent? That line, that change in skin quality and hair distribution, is your circulatory system drawing you a map of exactly where the damage has reached. A study published in Frontiers in Aging found that the combination of shiny skin texture and absent hair growth on the lower legs correctly identified undiagnosed peripheral arterial disease associated with prediabetes or type 2 diabetes in 81% of cases in adults over 60. 81%. From a visual observation alone. And yet almost no patient who walks into my office has ever been told to look for this. They have never heard of it. They see the shiny skin on their ankles and assume it is just aging. They notice that the top of their feet are smooth and hairless now, and they think nothing of it. This is why I made this video, because this information exists in the medical literature. It is not secret. But it is not making its way to the people who need it most. If you believe that knowing these 9 signs can help you or someone you love, type yes in the comments right now. If you are skeptical and need more convincing, type 0. Either way, your response matters because it helps other people watching this video know they are not alone in wanting this information. Now, let me tell you exactly how to use what you have learned today. Here is your action plan. Starting today, once a week, perform a complete foot inspection. You need good light, your reading glasses if you use them, and about 5 minutes. Sit on the edge of a chair or bed and go through this checklist. Look at the skin on your heels and soles. Are they excessively dry, cracked, or thickening despite moisturizer? Look at your toenails. Are more than 2 affected by color changes or texture changes simultaneously? Press gently on your ankles. Is there soft puffiness that leaves an indentation? Look at any current minor cuts or sores on your feet. Have they been there for more than 2 weeks without clear healing progress? Note any burning, tingling, or numbness, particularly at night. Check the temperature of both feet using your palms. Is one consistently colder than the other? Look at the structure of your toes. Are any curling, crossing, or pulling out of alignment? Look at the skin on your lower legs and the top of your feet. Is there a shiny, thin texture? Is hair growth sparse or absent below the mid-shin? If you identify 3 or more of these signs, or even 1 or 2 that are persistent and worsening, do not wait for your next scheduled checkup. Call your doctor and specifically request a fasting blood glucose test and a hemoglobin A1C. Tell them you want to rule out prediabetes or undiagnosed type 2 diabetes. A 1C gives you a 3-month average of your blood sugar and is far more informative than a single fasting glucose reading on its own. And do not make these critical errors. First, do not assume that because you feel generally fine, your feet's warning signs are not serious. Diabetes is famously asymptomatic in its early stages. You can have significantly elevated blood sugar and feel almost nothing systemically until the damage in the extremities has been building for years. Second, do not wait for your annual physical. The signs on this list are telling you that the process is already underway. A blood test ordered next week costs nothing and tells you everything. Third, do not dismiss foot symptoms because you have no family history of diabetes. While genetics play a role, lifestyle factors, age-related metabolic changes, and years of dietary habits can produce type 2 diabetes in people with no family history whatsoever. Within 1 week of beginning weekly foot inspections, you will have a clear baseline. You will know what is normal for your feet right now. Within 1 month, if there are changes developing, you will catch them, not your annual blood work. You, with your own eyes and hands. Within 3 months of working with your doctor on any identified blood sugar issues, the research is clear. With dietary adjustments, structured physical activity, and appropriate medical management, A1C can drop significantly. Circulation can improve. Nerve symptoms can reduce. The body has a remarkable capacity to recover when it is given the right support early enough. Your body is not broken. Your information has been incomplete. Until now. I want to close with something I tell every patient I see for the first time. The fact that your feet are sending warning signals is not a tragedy. It is a gift. It means the window is still open. The damage is not irreversible. The trajectory can still be changed, but only if you act on what you now know. Think about the people in your life who could benefit from watching this. Your brother who never checks his feet. Your neighbor who keeps complaining about burning toes at night. Your old friend who mentioned her heels crack no matter what she does. A simple message from you, sharing this video, could be the thing that changes the outcome for them. Please share this. You might save a life, and you might not even know it. If this video helped you, hit that like button. Subscribe to this channel so you never miss the honest, practical health information we share every week for adults over 60. And leave me a comment. Which of these 9 signs surprised you the most? Which one are you going to check on right now? I read every single comment, and I genuinely want to hear your story. Because remember, aging does not take away your body's ability to warn you. It simply asks you to listen more carefully. Today, you learned how to listen. Take care of yourself.